Everybody, Dr. Patel here. Sorry about the delay getting to you. I hope you all are doing well this Friday. Today we are going to be talking about the hip-back connection. So we're going to be discussing hip pain, continuing on our conversations from last week, or last few weeks, last time. I think it's been a few weeks since we were doing this, but we last time discussed different things that could be causing pain in the hip, different muscle structures, the hip joint itself, as well as potentially the cause of the hip that could be coming from the low back, including things like nerve irritation. But I want to dig a little bit deeper into the connection between the back and the hip, because we realize that not only can hip pain be directly coming from the low back, but oftentimes the low back can be indirectly associated with the hip. This is actually something that we commonly see when something in the low back is influencing the way that the hip is, or quite frankly, vice versa. But this is a part of the reason why the hip joint ends up being a very challenging area for people to treat. And part of the reason why some conservative methods oftentimes fail when it comes to hips, or also why hip pain can go from being very, very mild to all of a sudden more severe and requiring surgery. So it's a complex region, it's a complex area, and I want to delve a little bit more into some of the anatomy and some of the biomechanics, some of the interconnections between the hip and the low back. So before we get started, if you like this video, if you enjoyed it, if you found it helpful at all, please please subscribe to see future videos, and please share that we can kind of spread the knowledge and explain to people that there's, the body is an amazing and beautiful and complicated thing, but if we break things down, we can understand it, and we can get you going in the right direction with your life. So if you have other topics that you want me to discuss, please feel free to contact us. You can comment, you can DM, you can email us at info@fxregencenter.com. For all our previous videos, you can check us out on Facebook, on YouTube, or on our website, fxregencenter.com. Under patient resources, you can see all of our previous Facebook Live videos. And hi, everybody. Hi, Kathy. Hi, Courtney. Thank you for joining us, and hope you enjoy this. Courtney said, nerve irritation in the low back, not familiar. Interesting. Unfortunately, some of us are more familiar with nerve irritation in the back than others, but hopefully this provides some clarification as to how that could actually be related to the hip. So I'm going to start drawing a little bit, and we can talk about the different things that are going on in the back of the hip. So when we talk about the back, I've mentioned this before. It's like a stack of bones on top of each other, and really ultimately they're like a stack of kind of coffee mugs on top of each other when you look at them from the side, right? With the disc in between. And when you look at it from the front, which is this picture here, the low back actually ends in what's called the sacrum. The sacrum connects to the pelvis in the sacroiliac joints, and that's my poor pelvis here. Not very pretty, but it's all good. And then the hip joint itself is actually off to the side. And when people talk about hip pain, as we discussed last time, hip pain could be in multiple different areas. It could be in the front of the hip, the back of the hip, the side of the hip, right? A lot of people describe hip pain as this pain that's on the side of the hip at that bone that's there. And again, that typically, that pain on the side of the hip at that bone is actually not the hip joint all the time. It can be hip joint pain, but oftentimes this is associated with that bone out there called the greater trochanter, and the muscles that come and attach over to that region. And then the hip joint, in the textbooks, typically we describe hip joint pain as in the groin or in the front of the hip. But that could radiate down the thigh, that could be felt on the outside of the hip, in the buttock area, etc. And there's multiple different ways that the low back can actually be involved in the hip. So one of those ways, as I've discussed in the past, is that we have nerves that exit out of the low back and go down the legs in different distributions. And these nerves, when there's a pinched nerve or where there's irritation in various different areas, that can actually refer pain directly to the hip region. And oftentimes people think of sciatica as pain in the butt or pain going down the leg. Well, that's nerve irritation in the low back that's actually contributing to those symptoms. So directly responsible for hip pain, nerve irritation in the low back can be a piece of the puzzle. And Kathy said, this is all I feel when walking or done walking. Is this why my low back hurts when I walk? Well, walking is one of the things that can certainly cause pain in the back. Things like facet joints that could be getting irritated, nerves that could be getting irritated. If the space for the nerve is narrow, which is called stenosis, when we're walking, that space can cause pressure onto the nerves. And ultimately that can cause, there's various things that can cause low back pain, but also that nerve irritation can cause us to have pain that is perceived in actually the hip area. But nerve irritation comes in a few different flavors, right? Number one, pain number one is nerve irritation can cause pain. And typically that's not necessarily pain in the back, although it can cause pain in the back. Typically when we talk about nerve irritation causing pain, it's actually pain that's going down into the leg. And different nerves in different areas cause pain. So these nerves down lower at the L5-S1 area can have a variety of different distributions of the pain. Again, in the textbooks, we talk about L5 pain going into the buttocks and down the side of our legs, towards the side of our lower leg to the top of our foot. S1 pain could be in our buttock and down the back of our legs all the way to our heel or bottom of our foot. L4 nerve irritation can also go to the buttocks, but also can wrap around the front of the thigh towards the front of the knee. L3 nerve irritation can also go to the buttocks, but can also go to the front of the hip and into the groin area and the front of the thigh. And then L2, L1 nerve irritation can actually present as pain into the groin. So your typical area of hip joint pain could actually be coming from the area of L1, L2. And I've seen patients that had little disc bulges at L1, 2 that are actually contributing entirely to their hip pain. Unfortunately, I've seen some patients that ended up with a hip replacement surgery because their hip x-ray showed some arthritis, but in actuality, their pain was never coming from the hip ever. They got the hip replacement, they had continued pain, and ultimately we discovered that there was a disc bulge at L1, 2. So nerve irritation in the low back, one of the three major manifestations of that is that it can cause pain going into the hip region. But nerve irritation in the low back can cause more than just pain. It can cause numbness or tingling. You may be familiar with like that leg falling asleep sensation, or numbness like you can't feel, or tingling like ants crawling, or water flowing over your legs, or things along those lines. These are symptoms of nerve irritation as well. But number three, and this is what I want to really focus on, the third thing that nerve irritation in the low back can cause is weakness. Now, when I say weakness, I don't mean that we're dragging our leg around, or that our leg's completely collapsing, or that we're paralyzed. That can occur, specifically if the nerve is damaged. We can get things like a foot drop, or our toes dragging, or we got to swing our leg in order to walk because those muscles are weak. But even if the nerve is just irritated, now we're not talking about full-on nerve damage, but even if the nerve is just a little irritated, the nerves are the electrical wiring that go to our muscles. So if the nerves are irritated and not sending the appropriate signals to the muscles, then the muscles don't fire properly. So if you've heard any of my previous videos, or if you're one of my patients, and you probably heard me say the analogy of the light bulb that's flickering above your head. If you ever walk into a room and that light bulb's flickering, especially those fluorescent lights, right? Those light bulbs are flickering. Well, that's not necessarily a problem with the light bulb, right? The light bulb might be perfectly fine. You can switch out that light bulb and you'll still end up with that flickering, right? It's not a problem with the switch necessarily. You could flip the switch as much as you want to. It's still going to flicker. But it's a problem somewhere along the electrical circuit, the wiring. Something is going on that's causing that electricity to the light to not work properly. And that is what happens when there's nerve irritation in your low back. So that nerve irritation in the low back can cause the muscles to just not fire appropriately, and that can lead to other issues. So what happens when that occurs? Well, you could try to strengthen your muscles, right? You could try to tell those muscles with your brain to work, but if there's a disconnect between the brain and then the nerves of your low back going down into those muscles, well, those muscles aren't going to fire properly, right? We could try to flip the switch as much as we want to. It's not going to turn on consistently. So the same kind of concept is true. And again, this isn't necessarily like you're completely weak, but if those muscles are just not firing properly on one side compared to the other, well, that's going to cause us to walk funky. Right? That's going to cause us to move in an inappropriate fashion. And that's how other areas can get irritated. This phenomenon can actually cause us to get irritation to other joints, such as the knees, the ankles, the foot, etc. But it's very common for this to be involved with hip conditions. So why does this happen? Why does this happen? How is it that this is a common thing that occurs? Well, we got to think about the hip joint a little bit three-dimensionally. So right now in this picture here, we're looking straight at the hip joint. But let's say we're looking at the hip from the side, right? So if we're looking at the hip from the side, and this is your hip joint, here's the ball and here's the socket, right, of the pelvis. We have muscles that connect on the side, things like your gluteus medius and gluteus minimus. We have muscles in the back, like your hip external rotators, like your piriformis that goes all the way to your sacrum. And then we have muscles in the front, like your hip flexor muscles, and then muscles on the inside, like your hip adductors. So if this is the front basically of your body and this is the back of your body, you have this balance between the front and back of various different muscles. And that's what keeps us moving. That's what keeps the hip joint moving. Now, if we think about that, an imbalance of these muscles can also put pressure into the hip joint itself. So what do I mean? If these muscles in the back of the hip are not firing properly, but these muscles in the front of the hip are perfectly fine, then the front of the hip muscles are going to pull while the back of the hip muscles are going to be weak. And that can cause an asymmetry of the joint here and cause us to put more pressure into certain areas of the hip joint. Now, that's an important concept. So imbalances in the way that we move can cause pressure into one part of the hip more than the other. And if there's more pressure on one part of a joint, or if there's more friction on one part of the joint, well, the cartilage, the smooth surface of the joint, will start to gradually wear away, and the bone underneath the cartilage will start to get rougher. Eventually, the bone will start to get bruised, and eventually the bone will actually break down. And that spectrum is osteoarthritis, or that wear and tear of the joint. That doesn't necessarily equal pain, but if we're putting abnormal pressure, abnormal motion into a joint that's starting to develop arthritis, well, that can certainly become painful. And why would we be putting abnormal pressure? Well, the thing that's causing the irritation in the first place, the imbalance of musculature, is what can oftentimes cause us to put abnormal pressure into the joint and cause pain to occur. So that's why we oftentimes see a combination of people that have hip arthritis and actually issues that are going on in the low back. The most common areas that get irritated as far as nerve irritation in the low back is usually your L5-S1 and sometimes your L4-5 regions. Well, that's an important thing because the L5-S1 nerves, a little bit of L4 nerves, are in charge of the muscles in the back of our hip. So if those nerves are not firing correctly, and therefore those muscles are not firing correctly, but the front of the hip muscles that are coming from the L1, L2, L3 nerves, those nerves are firing correctly, so the front of the muscles are firing correctly. That's where that imbalance comes from. Now, that's why when we do things like a cortisone injection into the hip, we end up providing benefit to the pain that's coming from the hip joint. But if we don't correct the musculature, if we don't correct the underlying reason why we're walking improperly, well, the cortisone injection only lasts for a couple months, and once that medication wears out, we go back to aggravating our hip joint. Now, that's why it's so important for us to involve the appropriate physical therapy and exercise to strengthen not only the muscles around the hip joint, but also the muscles around the low back. We want to strengthen our trunk, our core, stability, in order to take pressure off of the back, take pressure off of the nerves, and get those nerves firing appropriately so that our muscles get the appropriate chance to heal and fire the way that they should be. Now, what happens if we're doing the physical therapy and we're exercising and we're just not able to get our glutes to fire? Well, therein lies the problem. We need to take a step back and analyze, is there still some level of ongoing nerve irritation in the low back that might be contributing? So that's why when I see patients that have hip conditions, I always look at what are the mechanics of what's going on. What's the knee doing? What's the ankle foot doing? What's the hip joint doing? But also, is there a component coming from the low back that we need to think about? And it might be as simple as doing the appropriate physical therapy exercises to address the low back, or it might be that we need to do some sort of procedure to calm down the nerves of the back, or actually get the nerves to fire properly, and then work on strengthening the butt muscles, then work on strengthening the muscles around that hip joint. So that's one of the main things that I think is actually neglected oftentimes when people talk about hip pain. We oftentimes neglect the very realistic possibility that the nerve irritation in the low back might be actually a big piece of the puzzle. But there's something else that could also be a connection between the low back and the hip, and that's actually the sacroiliac joint. So the sacroiliac joint is these guys over here. Oops. Are these guys over here on either side. And that's the interface between the sacrum, which is the base of the spine, and the pelvis of the hip complex. And the sacroiliac joint is one of those things that I honestly feel bad for. I think that the sacroiliac joint is oftentimes demonized as like the main thing, whereas it oftentimes actually is a secondary to other stuff that's going on. There are a few circumstances that the sacroiliac joint can be the issue. The number one thing is if there's been trauma. So I had a patient today who had a history of a fall downstairs in which she landed on her butt. Well, that's certainly something that can cause some aggravation directly into the sacroiliac joint. I had another patient a few weeks ago who had a little bit of low back stuff going on for a period of time, but her back pain went up through the roof. Her back and hip pain went up through the roof when she fell off of her bed in the middle of the night when trying to get to the bathroom. And when she fell, she landed on the side of her hip, and that started this pain that was going throughout her low back and into her hip region. So this is pain that was kind of going throughout this whole area here. And on a thorough physical examination, we determined that it was not actually her hip joint, but it was actually her sacroiliac joint that was the culprit. So that the number one reason the sacroiliac joint can cause pain is a trauma. And sacroiliac joint pain can be in the low back, in the buttock area, or can even refer into the front of the hip, the side of the hip, etc. So that's something that definitely could be a big connection between the hip and the back. Now, the second reason the sacroiliac joint can get involved is if we have a systemic autoimmune or pro-inflammatory condition such as ankylosing spondylitis, your rheumatoid arthritis, or conditions such as those that actually cause inflammation throughout our body and specifically target areas like the sacroiliac joint. The third reason is actually can technically fall into the trauma category as well. The third reason is actually pregnancy. So pregnancy is a time period where that sacroiliac joint can get irritated for a couple different reasons. Third trimester of pregnancy, the female body releases this hormone called relaxin that relaxes all the ligament structures that are holding those joints together in order to allow for that pelvis to move for baby to come out. And that relaxation of those ligaments can cause friction or irritation to the sacroiliac joint. And then the act of giving birth, right, the pelvis opening up in order for baby to come out can cause a lot of pressure onto the sacroiliac joint. So that can certainly cause pain as well. But the indirect reason that the sacroiliac joint can get involved, again, goes back to that nerve irritation in the low back. You know, that if the L5-S1 nerves, for example, are irritated and therefore the buttock muscles are not firing properly on one side compared to the other, that can ultimately cause some abnormal motion in the pelvic girdle, can cause some torque across the sacroiliac joint and cause the sacroiliac joint to become painful as well. So now the sacroiliac joint can refer pain into the groin and into the hip region. We've got to also understand what the sacroiliac joint is. That is the interface between the base of the spine and the pelvis. And the pelvis really is a ring that is, think of it as kind of like a pretzel, right? Where we have these joints in the back, the sacroiliac joints. We have the joint in the front called the pubic symphysis. And all of those guys are involved with the positioning and motion of the hip. And if there's issues with any of those areas, then that can certainly cause some abnormal mechanics into the hip joint itself. So that's how there could be a lot of this interplay, this back and forth between areas like the sacroiliac joint, the low back, and the hip joint itself. So it sounds complicated, and well, the reality is it is complicated, and that's why if we have issues in our hip region, it's important to make sure that you get evaluated and get somebody that puts their hands on you and examines you, potentially get additional imaging to see exactly what's going on, so we could really figure out what are all the different components that may or may not be involved. What are the primary things that might be the main issue, but also what are all the secondary things that could be either contributing to the main thing or caused by the main thing, and ultimately a piece of the puzzle. And how do we do this? Courtney asked, is there a way to test or see an MRI which muscles aren't firing or engaging properly? Well, it really depends on what's going on, what the picture is. Physical examination is one of the main things that I use to figure out if muscles are not firing correctly, or if they are or are not firing correctly. MRI, unfortunately, can't tell much because MRI is a picture in time. It's not showing the function of a joint or a muscle. What MRI can show is if there has been muscle atrophy, specifically if it's asymmetric atrophy, if the butt muscles, for example, or the small little muscles of the low back on one side are not firing as much as the other, then over time those muscles actually die back, they get smaller in size, and some areas actually get replaced by fat. And that's a sign that we can kind of, in combination with the appropriate physical examination, determine, all right, is there some muscle deactivation occurring or not? And a lot of times, a radiologist might not even talk about that because it's not something that's necessarily surgical, not necessarily something that's pathologic, but it's a sign that there's some asymmetry of things going on. And that's why it's really important for the physicians out there that are listening to make sure you look at the imaging yourself to kind of determine what's going on. There is a test to test for nerve damage and how those nerves might be communicating with the muscles, and that's called electrodiagnostic study. It's also called EMG or NCS. NCS means nerve conduction study. EMG is electromyography. That's a two-parted test. The NCS is a series of electric shocks that are done throughout the legs to see how the nerves are actually conducting electricity along the circuit. And then EMG is a series of small little tiny needles that are put into various different muscles to see how those nerves are communicating with those muscles. And if we have nerve damage, in some areas if we have some just nerve irritation, but speaking specifically about nerve irritation in the back, this is not a good test of just testing if the nerve is just a little irritated. It is a good test to test if the nerve is damaged and inappropriately communicating to muscles. And it's definitely more of a functional study than an MRI would be. Kathy asked that she had knee surgery in 1987 and that the knee or leg bows out slightly. You know, certainly these are the type of biomechanical things that can contribute to both hip pain and low back pain. And oftentimes this ends up being kind of like a chicken or the egg type of scenario. Kathy asked, can I do just a whole body scan? You know, a body scan is not the greatest thing because the reality is that a lot of things that we see on imaging might not necessarily even correlate with any symptoms. Now, if we have symptoms and we do a thorough physical examination, we're able to pinpoint that we want to discover something about an area based off of that exam, well then yeah, certainly imaging is a very appropriate thing that we should be doing to figure out what exactly is going on. Danny's joining us. Thank you for joining. Says, my sacroiliac joint was stuck for a long time. However, can be linked to my pars defect, which is linked because of spina bifida occulta. So spina bifida occulta is a condition that can oftentimes affect the spine. And pars defect is essentially a fracture or a defect in the bone, a part of the low back region, and a part of the bone called the pars interarticularis, which is involved with kind of the motion and the dynamics of the spine itself. And this does not necessarily have to be a traumatic fracture. It can be associated with various different conditions, including degenerative conditions. And ultimately, that pars defect itself could be painful. It can cause referring pain to the sacroiliac region. The pars defect could be involved with some instability, which could then irritate the nerves, which can then get the sacroiliac or hip joints involved. So there's a lot of different things that could be contributing and a lot of kind of back and forth between the low back and hip regions. Thank you, Danny, for sharing some resources on spina bifida. I think it's very, very important for people to recognize that these certain conditions are there, they're out there, and that might be a piece of some people's conditions and journeys. And Kathy said, what can we do to strengthen our low back? When I do abs, my low back hurts more than the abs. Well, it's interesting because strengthening the low back is a very, very important and instrumental thing, but depending on what we're doing, it can aggravate stuff, right? So if we're doing things like sit-ups, sit-ups could be fantastic or could be absolutely horrible, depending on what's going on with the low back, right? If there's an issue with the disc, if there's an issue with the nerves, then doing things like sit-ups might actually cause pressure into these areas. Crunches might be more safe, when you're in a neutral spine position. Things like planks and various different trunk stability exercises, bird dogs, cat cows, various different, can't think of words right now, Supermans and things like that, could all be beneficial for the right type of condition. And this is where, making sure that we go under the guidance of an appropriate physician or physical therapist, actually, to guide the appropriate exercises may be very, very necessary. because the reality is that our spine is a very resilient thing, and as is our hips, and we can have things going on in there and still live full and fruitful lives. But we also need to be very cognizant when we have an injury, when we have a condition that's causing issues, and particularly when there's issues in biomechanics, we definitely do need to get our body moving in the appropriate manner, and doing exercises that help while avoiding exercises that are going to make the situation worse. Courtney asked, how do we get those nerve tests done? Those nerve tests can be ordered by a physician. They can be done by various specialties. My specialty, physical medicine and rehabilitation, is trained to do these type of diagnostic tests. Neurologists can get a further fellowship training and do these tests as well. These tests are not always necessary, but when there's the potential of actual nerve damage involved, they could be really beneficial. Quite frankly, I don't use them as frequently as I have in the past, because oftentimes we're not dealing with overt nerve damage, but we are generally dealing with nerve irritation, and quite frankly, a thorough physical examination is typically enough for us to figure that out. But the gist of it, the summary overall is that the back and the hip are oftentimes very, very interrelated. And even if you have just hip pain and you've never had back pain a day in your life, if the hip pain resolves with appropriate exercise and physical therapy, great. But if we're having lingering things, or if we're having things that are coming back frequently, things that are getting in the way of our motion, or especially if we start recognizing that we're not moving correctly because of things like your hip, then it's really, really important to take a step back and get the thorough examination to figure out not only what's going on in the hip, but are there other pieces of the puzzle, upstream, downstream, that could be contributing to the picture, and how do we address your body as a whole in order to get you going in the right direction? What's the appropriate imaging? What's the appropriate test? What's the appropriate treatments? What are the appropriate treatments that can be beneficial for a situation like this? And we really have to put on our thinking hat and take a step back and look at the whole picture, especially if we're failing our more conservative standard treatments that are good for more minor conditions. It is complex. It is a lot to swallow. But it is something that makes sense when we take a step back and look at it. Really, really important. And quite frankly, even though the hip can be a very big challenge to treat, and even though sometimes hip replacement surgery actually is the best option for a hip condition, we can oftentimes avoid surgery, or we can oftentimes improve our outcomes after surgery if we recognize that there's that low back hip connection. And if we manage all of these pictures, all of these pieces of the puzzle, all of these components simultaneously, comprehensively, then we can get significant benefit. Finally, Courtney asks, is stenosis reversible? Stenosis in reference to the narrowing of where the nerves are traveling, which can contribute to nerve irritation. Unfortunately, there's nothing that we can do in this world that can reproducibly decrease stenosis. Once we go down that route, that space is oftentimes narrowed. But it also is a question of what's causing the stenosis. Bony stenosis due to arthritis is not something that we can reverse. There are surgeries that can shave down some of the bone, but we do also have to be careful about the possible effects of that. There's stenosis that could be contributed to by the thickening or buckling of ligament structures, the loosening of ligament structures. Stenosis could be contributed to by disc bulging. And these are type of things that we may actually be able to provide benefit for. We do have case reports of disc bulges decreasing. We do have cases where we've had the ligaments actually improve and make even microscopic amount of room. What's fascinating is that we've had places where patients had significant benefit to their symptoms that's due to their stenosis, but on repeat imaging they had zero change in their stenosis at all. And we theorize that's because if we strengthen all the things around the stenosis, and in combination of strengthening those things and doing the appropriate physical therapy to take pressure off of the area, and if we can get the nerves firing properly, get them less inflamed, then we can actually get long-term benefit. And by strengthening various things, we can, in theory, slow down the progress or slow down the degeneration of the osteoarthritis and stenosis. But unfortunately, arthritis and stenosis are technically degenerative processes. If we don't do things that help with slowing down that process or help stabilize that process, then things could gradually get worse over time. Not necessarily, but could. The good news is there's a lot of things that we can do, everything from exercise to nutrition to various orthobiologic injection procedures that can really help with providing stability to the region, improving symptoms, but also theoretically slowing down the progress of degeneration. I hope that all helped. This was a session that I think was really important because I do think that the back is oftentimes neglected when the hip is involved, and we end up kind of myopically focused directly on the hip. But there is oftentimes, not always, but oftentimes there is a connection between the hip and the back, and I hope this helped with clearing that up a little bit. If you have any further questions, again, feel free to comment. You can DM, you can email us at info@fxregencenter.com. Again, if you thought that this was helpful at all, please like it, share it, and if you have other things that you want me to talk about, hit us up. Hope you all do well this Friday afternoon. Wishing you a great weekend. I'm not going to be doing Facebook Live next week because I'm going to be going out of town celebrating my daughter's 3rd birthday. But I'll be back in tune. Stay tuned. In a couple of weeks, I'll be back. Looking forward to seeing you all then.